You're watching ABC4 News.
Welcome back. October is Breast Cancer Awareness Month, and we continue the conversation today with Dr. Roger Hansen, a radiation oncologist at Ogden Regional Medical Center. Now, let's talk about, as a doctor who helps treat women with breast cancer, how important are those mammograms and women doing them regularly?
Well, thank you for having me. We live in a remarkable world. There are tremendous advances being made in cancer treatment, but specifically in breast cancer treatment, and mammograms are a big reason for that success. Mammograms, as you know, allow us to find breast problems when they are very small and very early. I think a lot of people are surprised to hear that we have cure rates with early breast cancers that are 98, 99%. That's remarkable, and a lot of that success is because of mammograms.
Now, let's talk about the pandemic. Of course, it has caused problems for everything, but it also has for mammograms as well. Let's talk about people not getting them as often as they should, even though it really is safe.
Yeah, hospitals are perhaps our cleanest place, and it's very safe to come to the hospital and have your mammogram. Mammograms are paid for by insurance, and even if somebody doesn't have health insurance, hospitals have programs that will allow you to get your mammogram for free. So please come in for mammograms. Don't let COVID scare you from coming into the hospital. It's very safe, and a mammogram can save your life.
Very, very important and simple. So fortunately, all mammograms will not come back clear. Let's talk about how radiation therapy can help, and really how this is how you play a part in a woman's treatment.
Yes. Well, if a mammogram does show a problem, then hopefully it will be small and early. That's the whole idea. A cancer patient is going to be hooked up with a team of cancer professionals. And this whole team of people, we meet together regularly to talk about the best way to treat your specific cancer. I think it's reassuring for cancer patients to know that there's this team of doctors and other professionals who are doing their best to take care of you. It's not just one doctor who makes all the decisions. And as far as the role of radiation, you know, once surgery is done to remove the breast cancer, then radiation is given to the breast to sterilize any microscopic cell that might have been left behind. That's kind of the nature of cancer. There's the main part of it, but then sometimes there's little microscopic extensions that come off of that, and it's hard with surgery sometimes to remove every last cell. But radiation to the breast is just remarkable at sterilizing everything and making sure that cancer doesn't come back.
And that's where you come into play. But quickly here in our final moments, let's remind everyone once again to get that mammogram, hopefully catch it early so that treatment becomes easier for the problem, right?
Exactly.
Okay, thank you very much for joining us.
Having me.
We appreciate it so much. More information about Ogden Regional Medical Center can be found online at abc4.com.